India is now being ravaged by a second wave of COVID-19, with its total case surpassing 70 million on Monday. Now, medical oxygen and beds have become scarce. Major hospitals said they have no room for any more patients, and police fan out to secure oxygen supplies. Nations including Britain, Germany and the United States have pledged urgent medical aid to India. China has also expressed its readiness to help, and the two sides are said to be in communication on the matter. Why has the second wave hit India so hard, and where is the situation heading? I'm pleased to be joined from New Delhi by Professor Srikanth Kondapalli, Professor in Chinese Studies at the Jawaharlal Nehru University. From Shantou, Guangdong in southern China, Dr. Huachen, Associate Professor at the State Key Laboratory of Emerging Infectious Diseases of the University of Hong Kong. And here in the Beijing studio by Einar Tangen, a former US prosecutor, now a commentator. The warmest welcome to all of you. Let me go to Professor Kondapalli first. According to media reports, the rise in case numbers has been exponential in the second wave, and some attributed the surge to election rallies led by Prime Minister Narendra Modi, main opposition leader Rahul Gandhi and other important political figures, as well as crowded festivals and religious gatherings. If such is the case, why do people hold such activities without considering the possible impact of the virus?
Well, we have no causal connection between the gatherings and the eruption of the cases, because the election rallies, meetings have happened in West Bengal, where the elections are being conducted right now. But the number of cases have increased in Delhi and Mumbai, far away from these gatherings, number one. Number two, the religious festivals, the Kumbh Mela, it comes once in 12 years, and this is a religious sentiment for millions of people. What I heard was that there were actually precautions taken. Their temperatures, when they enter into the places, their temperatures are taken, like in the airports or in other places where these are a part of the protocol. But having said that, let me say in general, we have not been following the COVID-19 protocols. The mask wearing, sanitation, hygiene, social distancing. In general, there has been a problem with this. Europe learned after the first wave of the COVID-19, and later on, they maintained social distance, and they have also the masks being. United States, Brazil, India have not yet learned from this as of now, and we are paying a high price because of this not following the protocol. Not just in election rallies or in religious functions, but if you go to the market, there are so many millions of people without masks, the minimum required for this. So I think it's a hard-up lesson that we have to learn. East Asian societies, Japan, South Korea, China, they keep up the mask all the time whenever they are in the public domain. I think there is something to learn here.
Dr. Huachen, what is your take as the possible reasons or factors leading to the second wave hitting India? Are there other factors at play according to you?
So I think that, first of all, the COVID-19 is still an infectious disease. So this kind of virus always love the very crowded population and people gathering together. But I think it is very important the people's awareness of the virus risk. So I think why could China become so successful in controlling the initial and the subsequent outbreaks? I think the people's understanding, cooperation, and also awareness of the infectious of the virus. I think that's the important points. And we noticed that actually recently there might be several novel variants occurring in India. So this virus tends to have enhanced transmission capacity. So we still don't have any ideas whether they have already become more pathogenic or not. So I think scientists should immediately conduct some investigation to these novel variants to see what would be the possible impact impact on our human health and also the transmission.
Yeah, well, just now Dr. Zhu pointed out the kind of success that China has experienced, Einar. I have to say it comes with a very heavy price, right? Until this moment we're speaking, every flight that comes into China, the passengers have to go into 2 weeks minimum of, compulsory isolation. I mean, if you imagine all of the people that have so far be subject to this kind of treatment, it's not nice, but that's the price that everybody is willing to pay. It's just a reflection of the measures that are in place. But Einar, what do you think of the kind of challenges that the Indian government is faced with at this moment, and how serious is the situation?
Well, obviously you've heard about the health issues and these double variant that seems to be, or they suspect is part of this kind of outbreak. But right now what they need is vaccines. And right now internationally there's a lot of promises. The US is trying to okay AstraZeneca, get it through the FDA approval on emergency use, but that's 2 weeks away. That'll be another 42,000 people if 3,000 people a day are dying. The good news is that there haven't been any reported instances that people who have had the vaccine have actually died. There's some who have gotten it again.
So proving that the vaccines are effective in general?
Exactly. So they need that. The second issue here is political. Obviously, there is some danger to the government if, in fact, precautions weren't taken. But let's be fair to India. India does not have the kind of healthcare infrastructure that the United States has, and look at how the U.S. has handled this. So right now, expecting India to be a first world nation and treat everybody, it just isn't possible because it wasn't there.
Indian Prime Minister Modi has urged state governments to use lockdowns as the last resort to contain the second wave. What is the major concerns of the governments when it comes to lockdowns? Do you think a national lockdown or a more stringent one is necessary?
Well, I think we all know that the world over, the states are concerned about the economic growth rates. So lockdowns would affect the economic growth rates as well. So a cascading step, while you have specific lockdowns of specific areas, containment zones, etc., there could also be economic activity that could be permitted. For instance, last February, Vice Premier of China had suggested that there should be, Mr. Huachen suggested that there should be agricultural production, pork production. All these have to be maintained. So there has been an effort within China to open up the economic aspects and growth patterns. So there is a concern that many states have expressed that economic activity is also very important. Of course, safety is number one, but there is also a necessity for opening up in the economic domain. So this has led to an idea that we need to have a slightly differentiated or a plan B. Instead of complete lockdown, some sectors, some populated areas could be locked down, while economic zones, etc., could be opened up. So that was the concern, because we already are in a lockdown for the past 1.5 years.
Let me go to Dr. Zhu for the final question. What does the outlook look like? Because there are media that are predicting that the situation will peak, the number will peak in May. What is your assessment? How much more needs to be done, or how much more stringent the measures might need to be in order to not have a disaster, really?
Okay, so I think this is possibly just based on the past epidemic curve and models and also experience. But I only partially agree with this extrapolation. As I just mentioned, that new variants and new symptoms have been recently recorded, and the massive surge is so unprecedented. So I feel that the current situation in India is still quite worrisome, and I'm not that optimistic about it. So I think that actually as India has such a huge population, and many people are still struggling on the poverty line. And I think that it is not that easy to just push the very strict intervention and control system across the whole India. But I think to control infectious disease, the 3C principle still very
namely.
effective. Yes, so that's communication, coordination, and cooperation,
Okay.
or collaboration.
All
yes.
right. Many thanks to Einar Tangen, Dr. Huachen, and Professor Srikanth Kondapalli.